Dr. Fabion, good to see you. Thank you so much for joining us today.
Oh, thanks so much for having me. I'm delighted to be here.
Well, we were chatting just before we got on, and we said, this is the topic. It is a topic a lot of people are talking about, but it's one that you've been talking about for a very, very long time yourself.
Right. I think it's just one of those things that we get, quote unquote, the talk when we start our periods, but there really isn't that same conversation before we stop our periods. And I think it's a time when a lot of women are confused about what's happening and don't understand the symptoms and what they mean, and even what they're coming from with this hormone change.
Well, I think what's also interesting is the amount of time we're talking about, because it's really not just menopause. Perimenopause is, I think, an even more confusing time, and it just feels like such a mystery.
That's exactly right. I mean, these hormone changes start well before we have our last menstrual cycle, and that can start, 6 or more years before your last period. And women can have things like sleep disturbances and some occasional hot flashes, and maybe a missed period here or there, and maybe some extra bleeding that they didn't have before, and brain fog, and all of these other symptoms. And it can be a really confusing time.
Yeah, it really can. And then the amount of time that it lasts, I didn't realize it. I thought menopause lasted, maybe a year or two. I had no idea the range that we're talking about when we're talking about symptoms of the hot flashes, and the symptoms vary over the years.
Oh, that is so true. So I remember when I was in residency, we used to tell women that they would have symptoms for maybe a year or two and not to worry about it, and it would just go
Yeah.
away. But we now know that the mean duration is 7 to 9 years for hot flashes, and about one-third of women will hot flash moderately to severely for a decade or more. So, while not all women are going to have these bothersome symptoms, the majority of women do. Over 75% are going to have some hot flashes. So, it's rare to just get to your last menstrual cycle, have it all stop, and nothing really happens after that.
Yeah.
But then vaginal dryness is another thing we need to talk about. And that often comes a little bit later after the last menstrual period, maybe 18 months to 2 years or so, that sets in. And in contrast to hot flashes and night sweats, which ultimately do get better with time, that doesn't get better with time. So the vaginal dryness is something that we really have to pay attention to, because it won't go away if you ignore it.
Well, and let's talk about that, because we're talking about by the year 2025, over 1 billion women globally will have experienced at least perimenopause, right? We spent time as a culture kind of dismissing menopause as a thing, whether it was in the workplace, whether it was just, talking amongst ourselves. And now we realize it is a thing to be talking about, that we do have to have the talk. I don't know what we call the menopause talk now, but we do need to have that talk and stop whispering these words. And I don't know if we're there yet.
No, I don't think we're there. And I think there's still a lot of misconceptions about menopause and what it is and what it means to women. And, it shouldn't be embarrassing. It's a part of life that we will all, 100% of women will go through if they're lucky to live that long. So it is just a fact of life. And I think we really have to learn how to, have conversations about it without it being an embarrassing or taboo topic.
Yeah, it's funny. I said it out loud in there were a bunch of men in the conversation, and I said, "Yeah, I'm having a hot flash. I'm going through menopause," and all of them looked down at their phones, found something else to do, looked away, walked away as quickly as they could. I mean, they were embarrassed, and I thought, wow, that is true. Like that, nobody. It's still this taboo word subject. I don't know what it is about it, but I guess it's just we haven't brought it to light, discussed it enough, and it stands to reason that women feel alone dealing with it because they're not sure who to talk to.
Well, and I think experiences vary. I mean, when I told my mother I was writing a book on menopause, she said, "Why?" And I said, I said, "Well, what was your experience about menopause?" I never asked her that question. And
Sure.
she said, "Well, I may have had a hot flash at a cocktail party when I had a glass of wine once." And I said, wow. Okay. That's not the experience for most women, but I think it is highly variable. And some women really are just miserable during this time. And that's when we really need to have this conversation and say, not everybody is going to have a horrible time of it. But some people really do struggle. And there are things that we can do to help this be less of a traumatic experience for people and to help them get to that next phase of life. Because the fact is, we're going to live about a third of our lifespan after menopause. And so getting through that transition is really important so that we can be as healthy as we can for the rest of our lives.
You said a third of our lives. I'm sitting here trying to calculate those years real fast. I don't know. I don't know what they look like. Yeah, I talk to women all the time about it now. I turned 50 in December, and I started going through menopause a little earlier than that. I went through it with a doctor that wrote in my patient portal, "In menopause, any questions?" And that was it. It was a male doctor. And I looked down. I remember I was getting on a plane. I was heading from Tampa back to JFK. And I was like, I'm in a what? I'm in menopause. I sat there on the plane ride just staring at these words. I couldn't believe it. And I didn't even know what it meant, really. I screenshotted it so I could keep it, so I could ask any questions I had. But I did go through my experiences. I've gone through experiences at work. I anchored the news. I had an incident on the set that literally knocked me off the set onto a bathroom floor, with hot flashes and panic attacks and anxiety. And I didn't know what I was going through at the time. And long story short, after I started seeing somebody who dealt with women in midlife, she said, "Oh, you're in menopause. That's what that was. That was just a real severe symptom of it. And that does happen. You're not, it's not just you." And I think that's, what I want to impress upon women. I talk to so many that say, it's just, I don't know what to do. What are you doing? What are you taking? Where do you start? So when we look at some of the different options out there, where do you usually start for patients if they're going through sleepless nights, hot flashes, and the moodiness or the fogginess that comes with this?
Right. So when we talk about symptom management at this time, I think it's important, first I take an inventory of what symptoms are we trying to fix here. If a woman just has vaginal dryness and nothing else, then we can use some vaginal hormones. They're very effective. But if it's hot flashes and night sweats and joint aches and mood disturbance and palpitations, etc., really hormone therapy is the most effective therapy that we have right now by far. It is safe and effective. And, for the majority of women who are just going through menopause and within 10 years of the menopause transition and really are otherwise healthy, the benefits tend to outweigh the risks. So we now know, after looking at the Women's Health Initiative data, after so many years of reanalysis of that data, what we figured out was that there is such a thing as a timing hypothesis, meaning that starting hormone therapy early after menopause tends to be beneficial. Starting it later in your 60s or even in your 70s isn't beneficial and may even be harmful. So we call that sort of the window of opportunity for women and the use of hormone therapy. There are some contraindications to the use of hormone therapy, like any medication out there, and it's probably not something that you'll go on and stay on forever. We really just use it for symptom management, but it's highly effective and will reduce hot flashes by about 90 to 95%.
It's interesting. I haven't talked about this openly, but I went through just a massive amount of bleeding in perimenopause, where I had to have two polyps removed over and over again. And it really scared me. It scared me because I wasn't sure what to expect. I lost my mother at a younger age to breast cancer. She was diagnosed at the age of 44. I don't have the BRCA gene. However, it constantly, and it scares me. Every little thing is something that could be bad. And so I tried to not go on hormone therapy. I tried to not do it. And the first time I went on it, I started bleeding again and I went back off. And then I saw a doctor that really explained to me what was going on. So I went back on it. And since then, I have felt a little bit different. I felt some of the fog lift, some of the I don't know what I'm doing, lack of focus. Sleeping is a little bit better right now. I'm just starting to get back on it. But it really was something for me that I didn't want to do because I've always tried to be pretty homeopathic in my approach to things. However, nothing else was really working. And I really did do the everything else. I was told about the maca, and I was told about all the different supplements, but I guess for me, hormone therapy seems to be the thing that is working right now. And that's the mix of the estrogen and the progesterone.
Right. And I think for every woman we have to go through this sort of balance of risks and benefits and
Mhm.
take into account your medical history and your family history and what your concerns are. I mean, some
Sure.
women are extremely concerned about potential risks, but I think putting the breast cancer risk into perspective is really important. I mean, in recent years, we've really found out that it may be more the progestogen component that is the risk for breast cancer as opposed to the estrogen itself. Not that estrogen is completely 100% off the hook. But we found that with the Women's Health Initiative study, for example, that after all those years of looking at it, the women who were on estrogen alone for up to 7 years did not have an increased risk of breast cancer or death from breast cancer. And in fact, their risk was decreased and the risk of death from breast cancer was decreased. But the women who had the combination did have a slight increased risk of breast cancer. And that risk translates to roughly 8 to 9 extra cases per 10,000 women per year after about 5 years. So it's not a big risk, and that risk is about the same as somewhere between 1 and 2 glasses of wine per night. So we have to also put it into context with other lifestyle things that are going on. Like if we're overweight, that's probably a bigger risk than hormone therapy is actually. And if we're sedentary, that's also a risk, and alcohol is a risk. So putting it in perspective and especially when you're taking into account your symptoms and how you're functioning, I think that's the key. And is it for everybody? Probably not. But for
Right.
those women who are low risk
Right.
and really suffering from symptoms, it can be a life changer.
Absolutely, and I want to talk about something because I think the data registry on experiences of aging, menopause, and sexuality dreams. Can you talk a little bit about that? Because I know that a lot of the data and the insights come from a lot of this, but if people are not familiar with it, I guess what's exciting to me about that is the fact that there are so many studies that are done for younger people. There's so many studies done for older people, and then there's this midlife area that I feel like has been we know factually has been highly neglected over the years. So to see an
Yeah.
actual study about this and then adding menopause into that mix I feel like this is just the beginning, and it's a really good thing to see. But this dates to 2005, correct?
Right. Yeah, it's interesting. So this came from a clinic that we started in 2005 for seeing women with menopause and sexual health concerns. And
Mm-hmm.
so, now I think we're over 10,000 women in that data set. And it also includes women from all three Mayo Clinic sites, so Minnesota, Arizona, and Florida. And as you said, we probably have the largest menopause clinic in the country, I would think, because we see well over 3,000 visits a year. And of those, about at least 2,000 are new patients every year. So that's a lot of women coming in with a lot of concerns about menopause. And so we've learned a lot of what some of the associations are and who are these women that are coming in that are having such a problem and what is the story behind it. And we've learned that, a good portion of our patients are well over the age of 60. So we find that, it's not just the 45 to 55-year-old women who are having symptoms. There are older women that are still having symptoms. We find that there's a lot of mood disturbance. We find that women have a lot of weight concerns, and even though weight gain is not really a menopause thing per se, it's probably more related to the aging process. That's one of the concerns that is most problematic for women. They're most worried about that. So that and mood. They also have a lot of preconceived notions about menopause when they come in that we've learned about, what it means and negative connotations about it. And so a lot of what we do is really education. So the data set has been an amazing opportunity to learn and to educate.
Well, I love seeing that. And I love seeing the fact that we finally have some money people that are taking a serious look at menopause these days. And I know I'm sure you're following that with so many of the femtech companies moving
Right.
into that marketplace. I think it's been amazing, but I also think it's long overdue.
I wrote an editorial about that recently, and it's femtech, the good, the bad, or the ugly. And, I think it's good. There's more money being focused on this area, still not as much money as we have on erectile dysfunction for men. There's a
Sure.
vastly more dollars being poured into that area than there is in women's health. But still, not all of these companies are in it for altruistic reasons. And we need to really make sure that women are aware and educate themselves and understand what their options are. Because, not everything has evidence to support its use. And it's really important that women understand, do we have the science behind it? Does it work? Is it worth paying money for? Or is it just another gimmick where we're paying a pink tax on something that we don't need to?
Right, because I've seen so many things pop up of late, and I know. Look, I like the fact that there are ways to track symptoms, and I like the fact that there are ways to
Yeah.
kind of keep track of what you're going through and sharing those stories. But yeah, I would agree with you. There's some different things that have popped up out there that I'm not sure. And I often think those things just kind of fall away eventually. But you want
Right.
people to be treating their symptoms the right way and not wasting time, not doing that.
Exactly.
You have the Menopause Solution, the author of the book, The Menopause Solution. What I like about it is it's upbeat. It's not like this is the end. You say, you can be happy through this period. And it's not all doom and gloom. Can you talk a little bit about that? Because I think what you do is you take a real down to earth approach about it, and it makes it feel like, hey, we're all in this together.
Well, that's so true. And, I think a few things. So we're learning that the menopause transition is really maybe a time frame where women start having a lot higher risk for heart disease afterwards. And it's not all just hormone related, although it may be in part hormone loss related that our risk for cardiovascular disease goes up. But it's important to remember that heart disease is the number one killer of women. And that this is a time frame where we can really just sort of reassess our health in general, and we can say, am I living the best life that I can? Am I eating right? Am I sleeping right? Am I exercising? Am I maintaining my weight? And am I setting myself up to be the healthiest person, both mentally and physically, going forward? And so I think menopause is one of those times where women can just sort of step back, reassess, really take a look at their lives. Are they prioritizing the things that they want to prioritize? And so many women are putting everybody else above them on the list of what they need to be taken care of. It's important to remember, how in the airplane they go, put the mask on yourself first and then put it on the person next to you. Women don't do that. And I really think that menopause is that time where you can just say, I need to prioritize myself. I'm not going to be able to be the person that I want to be for my friends, my family, whoever I'm taking care of, if I'm not taking care of myself. And that means in every possible way, right? It means making sure that we're mentally and emotionally healthy. But it's also, have you accomplished the goals you want to accomplish? And do you like your job? And is it time to, do something different that you want to do? And there's so many examples of women that have taken up entirely new careers in midlife and had incredibly successful careers after that. So I think it's a good time for a reassessment in general.
Why is that? I've noticed that combination. And I was trying to figure out where that crossroads happens of menopause, midlife, new chapter, next chapter. There is definitely they all come together. And so I think that that's what makes it a little confusing for a lot of women is that, am I going through this because of menopause? Am I going through this because I turned 48, 50, 55 years old? Do you think there's just that intersection from what you've seen with regard to data, research, and just culture?
I think it's this time where you have aging parents. The kids are out of the house for the most part. They may be back in the house on occasion, but I
Yes.
think it's just this time where you are sort of at a crossroads for a number of reasons. You may realize that the spouse that you've had for the last 30 years is maybe not the one you spend the rest of your life with.
Gray divorces are huge.
They are. So all of a sudden, it's this time where things are, it's kind of being shaken up all over. Women are often at the peak of their career around this time too, and they may be getting the opportunity to for a promotion or a different job or taking a new opportunity down a different path. So I think it is a crossroads for a number of reasons. And I think women also get to a point in their lives where they may have more confidence than they had before, and they're not as afraid to take a chance and do something a little bit different in many aspects of their lives. So I think it's all in all healthy, but I think it can be a little rocky during this time frame, especially if you feel like you're not at the top of your game in terms of not sleeping well and maybe not performing as well at work, if you have brain fog and you're having anxiety attacks. So I think it's a time where we really need to say, if you're experiencing some of these things, we really can help with that.
I think it's so important also to know that you should be asking for help instead of dealing with it on your own or thinking, hey, when I was 30 years old, I knew to listen to a podcast or an app or do something a little bit different and fix it yourself, because I don't necessarily know that that's always possible. I tried to do that. It didn't work. I did not want to ask for help because I did not want to admit what I was going through until it popped up in my patient portal. So, so kindly.
A little disconcerting to learn about it in that way. Menopause. Any questions?
Any questions? I was like, all I have are questions. That's all I have.
I can just see your brain spinning right there and going, yeah, I got questions. I got lots of questions.
I have a lot of women asking me how to deal with menopause in the workplace, and I don't have the answer for that. I joke about it and say, well, I'm very open about it, but I don't know if that's for everybody, and I don't know that works in every workplace. Do you have any suggestions? I would love to see it be something where people are not whispering about it in the bathroom or just embarrassed about it altogether.
This is a tough one. I know there's been a lot written about this, and the North American Menopause Society just endorsed a statement from one of the European menopause societies that had to do with workplace changes, et cetera. I think it's important. So I feel like it's a little bit of a double-edged sword. I do think that we need to be able to have conversations about it. Is work flexibility a good thing in terms of, I'm not my best in the morning. Maybe I need to come in a little bit later. Fine. Do we need to make this something that women need special accommodations for? I really feel like the more we make this a medical issue for people, the bigger chance that we're going to have this backfire for women, and all of a sudden we're going to be saying that that woman shouldn't get that promotion because she is struggling right now and having issues with menopause, et cetera. Wow. So I don't want to make it to where all of a sudden it's a reason to not promote women or not hire women, or say, it's too difficult to give her that extra assignment. She's not doing well right now. And I could see that happening. So I really feel like, yes, we need to be able to have a conversation about it, but I don't think we need to use that as an excuse not to advance women in the workplace.